Hi, and welcome to the Cambridge Health Alliance Joint Replacement class. My name is Elise, and I'm one of the PAs in the orthopedic team, and I'll be presenting tonight with my colleagues Lauren and Taylor. So there are a bunch of people involved in your surgery, and we'll touch on the different disciplines. We have nursing, in addition to your surgeon and PA, nursing, anesthesia, PT or physical therapy, and OT or occupational therapy, case management, and interpreter services for those that need it. And we're all here for you so that you get the best care possible. Why should I have the surgery? So for most cases, it's because of osteoarthritis, where the cartilage lining of the joint wears away and you can develop bone spurs and the bones start rubbing together and it becomes very painful. Other reasons to have surgery would be rheumatoid arthritis, post-traumatic arthritis, where you have an injury and later on develop arthritis, or avascular necrosis, where some disruption to the blood supply for the bone causes the bone to die. We often start with pills, injections, physical therapy, gel, uh, all sorts of conservative measures. But for some people, they get to the point where they've tried everything, nothing helps anymore, and they cannot function with the pain the way it is. And at this point, the only other option is surgery or to do nothing. The goals of surgery are to reduce your pain, increase your ability to move, improve your quality of life, and get you back to doing the things that you enjoy doing. Your new joint will look something like this. So we do total hip replacement, total knee replacement, and total shoulder replacements. On the left with the hip, you see it's a ball and socket joint. So there's a metal stem that goes into the femur and a cup that's in the pelvis. And there's a head on top of the stem that rotates inside the joint. For the knee, it's a hinge joint. So once the arthritic parts of the bone are cut off, those parts are replaced with metal on the femur, metal on the tibia, and a plastic liner goes in between so you don't have the metal rubbing against metal. And there's also a little button that goes behind the patella so it slides smoothly within the groove. And then there's the shoulder joint, um, also a ball and socket joint, where again there's a stem that goes into the humerus and a part that goes into the shoulder blade, or this we call it the glenoid, and there's a plastic liner again so that you don't have metal rubbing on metal. Here are just some more pictures of the total hip replacement, the different parts on the left, how it would look on your x-ray after surgery, and then another drawing. Here are some more pictures of the total knee replacement, the different pieces that are in the middle of the screen. On the left, you have what your knee will look like after you have the surgery on x-ray, and on the right, another model. And for the shoulder, again, a drawing on the right, we often, for some surgeries, will use screws to make sure that cup is affixed to your shoulder. And here are the pieces in the middle and what um, some of the shoulders will look like on x-ray after surgery. There are two different types of shoulder replacement surgery, but we won't get into that. You will have a scar after the surgery because the surgeon has to cut through the skin to get to the joint. So on a shoulder, it may look something like this in the front. On the knee, you have an incision, a long incision on the front of the knee, and on the hip, the incision is on the side. Sometimes it goes more in the back into the buttocks. The incisions are closed using stitches that stay under the skin and they absorb into the skin, so into the body, so they do not have to be removed. We don't use staples. How to prepare for surgery. So you may have already discussed the list of things to do, your homework list prior to surgery with your surgeon or your PA. So we'll run through that here. So one of the items on the list is to take this total joint class, which you're doing now. You also have to see your dentist to make sure you do not have any infections in your teeth because that could lead to infection in your new joint. We also want you to meet with your primary care doctor to make sure all of your health issues are under control and that no new serious health issues have arisen. We also have you do an evaluation with physical therapy, and we also have some medical equipment recommendations for you to get prior to your surgery to help with the recovery. You also will have usually a televisit or in-person visit with the anesthesia team. We call that the pre-admission testing consult. A few more things. So if you smoke, you do have to quit smoking and quit all nicotine products. So that includes the lozenges, the gum, the patches, whatnot, because the nicotine can prevent proper healing of the wound. We also have this requirement for weight management. BMI is a measure of ratio of your height to your weight. And if that number is over 40, we do ask that you lose weight to meet that requirement because studies have shown that those with higher BMIs tend to do more poorly after surgery. They're at higher risk of infection, blood clots, etc. And we want to make sure that you're in the best possible situation for your surgery, so you have the lowest risk for any complications. If you have diabetes, that does need to be well controlled. We measure with this hemoglobin A1C level, and it has to be under 8. We will also test you for COVID prior to surgery, whether that's done 3 days before or the day of. It depends on your vaccination status, and the rules are often changing. So we will tell you what we expect when we see you in the office. And there's one more nasal swab to do. This is to check for bacteria MRSA or MSSA, which can cause nasty infections. So if you do test positive for these bacteria, then we would prescribe you a nasal ointment that you would put inside your nose for about 5 days prior to surgery. So again, just stopping all nicotine products, the also e-cigarette products that have nicotine in them, you have to stop that. If you need help to quit smoking, there is a CHA tobacco treatment program. Most insurance plans will cover the cost of medicine to help you quit smoking. The number is here on the screen, 617-591-6922, or you can go online to our website, challiance.org. Some other recent resources include the Massachusetts Smokers Helpline, 1-800-QUIT-NOW. There's some more websites, makesmokinghistory.org and smokefree.gov. So if you need help quitting, let us know and we can help you connect to the resources. What else should you know before surgery? So there may be some medications that you need to stop taking prior to your surgery. For instance, A lot of people take aspirin just as a protection for their heart, and we have people stop that about 5 days before surgery because it does thin your blood and can make you bleed more during the surgery. So we have you stop that about 5 days before. It's similar with Coumadin, and then things like methotrexate or prednisone, which we see our rheumatoid arthritis patients taking. You'll talk to your rheumatologist prior to your surgery to see when to stop those. But they do increase your risk for infection, and so we have you stop taking those prior to surgery. And then we put you back on them after surgery. Another thing is you cannot eat or drink anything after midnight, so no no food or drink. We want you to have an empty stomach so that when you're put to sleep during anesthesia, you don't uh, cough up any food and potentially get aspiration pneumonia. At least that's one reason for doing this. If you do take certain medications, such as blood pressure medications, we may want you to take those the morning of your surgery, so you can take those with just a few sips of water. Don't drink a whole liter of water. Just a few sips of water to get that medicine down. But when we see you in the office, we'll go through your medicine list and let you know what to stop taking. And at your pre-admission consult as well, they'll talk to you about which medications to stop or continue the day of your surgery. Consent form. So this is something we need you to sign before the surgery, otherwise we cannot do the surgery. And it goes through the risks, the procedure, alternative treatment options. And when you sign this, you're saying that you understand all this and that you want to proceed with surgery. Usually we do that uh, either in the office or the morning of your surgery at the hospital. As with any surgery, there are risks, and so these are some of the major risks of joint replacement surgery. They include infection, blood clots, blood loss, or losing too much blood, damage to surrounding tissue, nerves, vessels, persistent symptoms, meaning that despite having the surgery, you may continue to have pain afterwards, heart attack, stroke, and death, numbness around the incision because the surgeon has to cut through the skin and there are nerves in there that get cut. So you do have numbness after the surgery, stiffness, and in particularly for hips, there are uh, per- a few risks related to hips only, and that's hip dislocation, so where the um, ball comes out of the socket, leg length discrepancy, where one leg's a little shorter than the other, and nerve injury, um, because especially with a certain type of incision, it goes very close to the sciatic nerve that travels in your butt, and this gives you sensation and motor function to your leg, to your foot. So there's a risk of developing something called drop foot, where you can't raise your foot up. All of these risks are low, but they are potential risks, so we have to make you aware of them so that you know what you're getting into. What can I do before surgery to prevent infection? One is do not shave the surgical area. We will do that once you're in the hospital if necessary. Also, keeping your fingernails clean and short. We will also provide you with these CHG wipes, antibacterial wipes, that you will use all over your body the night before and the morning of surgery. And our nurses will go over that with you in the office. It's also a good idea to use some fresh new towels and change your bed sheets so you're sleeping in clean bed sheets. Um, we also give you antibiotics when you're at the hospital right before your surgery to reduce the risk of infection. How can I prevent infection after surgery? Well, you can wash your hands. People that you live with or any visitors should wash their hands too. Do not remove the bandage. And once the bandage is removed, do not touch your surgical site because that could introduce bacteria from your hands into the wound, and then you could end up with a serious infection, which is a huge problem. Here are some signs of an infection. So as you see in this picture, redness around the incision, drainage from the incision, worsening pain at the surgical site, fevers or chills. These could all be a sign of infection, so you should call our number right away. And there's someone available 24/7. We have people on call overnight. So if you're worried about infection, call this number and we will advise you what to do. To prevent blood clots, so this is another risk of the surgery, we will prescribe you a blood thinner, and either aspirin or Eliquis is generally what we use, and it depends on your medical history, how high your risk is for getting a clot at baseline, um, and you're usually on this medication for about 4 weeks after your surgery. A little more on safety in the hospital. So you'll notice that people will ask you to verify your name and date of birth a lot when you're there. And it's not because we don't know who you are necessarily. It's part of the protocol. The other thing we have to do is mark our initials on your arm or leg that's being operated on prior to surgery. So when you're in the holding area waiting for your surgery, we will mark your arm and leg. Just another way to make sure we prevent operation on the incorrect arm or leg. We need to know your allergies to medications and foods. Knowing your medical history and any surgeries you've had is helpful. We have the proper personal protective equipment for patients and healthcare workers, and mainly that's mask wear and eye protection. Another word of advice is to leave all your rings and other jewelry at home because it will have to be taken off. We have to put IVs in your arms and your hands. So it's best to leave that all at home so it doesn't get lost or have to be cut off if your hand gets too swollen. Okay, and anesthesia. So a lot of people have questions about anesthesia, and don't worry, you will be put to sleep for your surgery. You won't know what's going on, you won't hear anything, you won't feel anything. And there are a few types of anesthesia that we can use. You, your anesthesiologist, your surgeon, and your primary care doctor will help determine which type of anesthesia is best for you. So one option that people are very familiar with is the general anesthesia option. And with this option, you're given heavy doses of sedatives, and um, because of that, you cannot breathe on your own. So you have to have a tube inserted into your throat, and a machine will be breathing for you. This isn't too safe for people with COPD or other lung diseases. So again, depending on your medical conditions, this may not be the safest option for you. The second major option is spinal anesthesia, and this is just for the hips and the knees. We cannot do this for shoulders. So a numbing medicine is injected into your spine and it makes you numb and immobile below your waist. It could last anywhere from a few hours up to 18 hours. It reduces the amount of narcotics you need, nausea, mental status changes, but you're still given some sedative to make you fall asleep. So you'll be asleep, you'll be numb below the waist, but you'll be breathing on your own. So that's another benefit to this, is that you do not need the tube down your throat. For knees and shoulders, we can do this additional step of a nerve block. It offers great pain relief. It doesn't affect your mobility. It can last a few hours to 12 to 72 hours, usually not that long. Um, and it can be done with either the general surgery, the general anesthesia option or the spinal anesthesia option. So the anesthesiologist will use an ultrasound machine to find the appropriate nerve and will inject numbing medicine around that nerve. And here's a picture of it being done for a total knee prior to surgery. And here's a picture of it being done for the shoulder prior to total shoulder replacement surgery. All right, and I'm going to pass the torch on to my colleague Taylor to continue discussing the operating room.
Thanks, Elise. All right. So this is a picture of our operating room and the outfits that we wear during your surgery. What you can expect are bright lights, cold temperature, lots of noises and beeps, lots of people in there, including nurses, the scrub tech, who is the expert in our equipment, the surgeon, of course, the PA, and several anesthesiologists. You can expect to spend about 2 to 3 hours in here. However, you will be asleep, so it won't feel like that for you. This is an image of the PACU, or the recovering room. This is where you go right after your surgery is over, where you wake up from anesthesia. Again, you'll spend a couple hours in here recovering. Um, Once you're ready and able, you can begin to eat and drink. If you are doing an outpatient surgery where you go home the same day as your surgery, then the physical therapist will meet you here and start exercises and moving around. Depending on your surgery, you will wake up with one of these devices on. On the left, you have the knee immobilizer for after total knee. The middle picture is the hip abduction pillow, which prevents dislocation of your new hip. And on the right is the shoulder abduction sling, which prevents dislocation if you've had a total shoulder. We will use many tools to control your pain after surgery. That's one of our main concerns. So here's a picture of the pain scale. You may be familiar with it. So 0 would be no pain at all, and 10 would be the worst pain that you've experienced. We use this scale to determine which pain medications and how much pain medication to give you at a certain time. We'll also have ice, or we use something called a cryo cuff to cool the area that's had surgery. The nurses will help you reposition to get into a more comfortable position. And as it says here, do not suffer in silence. Let us know. We want to help you if you're having pain. So as I mentioned before, there are multiple ways to control the pain. So there are different medicines, treatments, and they all work in different ways to control the pain. And there are certain different pain pathways that we have in our bodies, so they work in different pathways. And overall, it'll give you a better pain control. So before your surgery, we're already working on it. We'll give you the pain cocktail. This includes Tylenol, Celebrex, and a long-acting oxycodone or OxyContin. Also, before the surgery, as Elise mentioned, you'll be offered the nerve block, which is very helpful. During surgery, while you're still asleep, the surgeon will be injecting numbing medicine around the area of the surgery. And then after surgery, um, we'll be giving you more of the medication. Some of them you'll get automatically or scheduled, and others will be as needed. So when you are letting us know that you're having pain. There will be medicines that go through your IV, Toradol and morphine. And then pills include Tylenol again, oxycodone, and Celebrex. Here's the image of the cryocuff that I mentioned, which is the ice therapy. And then physical therapy will also have different modalities to share with you to control pain. Again, talking about COVID-19, um, currently patients who are not vaccinated or have not received their booster shot do have to take the nasal swab before surgery. It's usually two days before surgery. You'll go to our testing site and get a test. You can also get tested at another pharmacy or site as long as you can provide documentation of the result. Um, if you are being admitted for your surgery or potentially being admitted, we'll also test you once you arrive to the hospital for your surgery. These policies are subject to change depending on the status of the pandemic. So as Elise mentioned, we'll update you at your visit prior to surgery what the current policies are. And then if you're hospitalized, the great majority of our patient beds are in shared rooms. So that means you most likely will be sharing a room with another patient. Um, Everyone who's admitted to the hospital is tested for COVID. So only people who have tested negative will be sharing a room. Again, we'll all be wearing our masks, and other times we'll be wearing eye protection as well in all areas of the hospital. We do ask that patients wear masks as much as possible, and especially when you're working with physical therapy out in the hallways where you're going to be around a lot of other people potentially. This is an image of the hospital floor where you would be admitted after surgery, 6 North. And this is an image of one of our rooms, and you'll go directly to a room with the bed there. You'll be served food. You'll start with clear liquids or a light supper on the first night, and then a normal breakfast the next morning. This is the call bell. So the red button is what you press when you need anything, need to contact anyone at the nurse's station. Do bring your cell phone and your charger. We do have phones available for use, but everyone seems to prefer their own phone. There's a TV at every bed, and we do allow visitors. At this time, the current policy is one at a time between the hours of 1 p.m. and 8 p.m. You have to call our main hospital number to schedule a visit. You may have an oxygen tube which is pictured on the left. It's called a nasal cannula if your oxygen is low after surgery. On the right, you have an image of the IV that you will have. They'll remove it usually the morning after your surgery because you won't need it anymore. And what can you do after surgery to help prevent complications and get better faster? As we've mentioned several times before, washing your hands is very important to prevent infections. And infection is one of our main concerns for preventing after your total joint surgery. And there's Purell outside of every room. Everyone who enters the room will be using it before coming in. To help prevent pneumonia, which is a fairly common complication of any surgery, we'll give you this incentive spirometer. The nurse will show you how to use it. It basically encourages you to take frequent deep breaths, and that will clear your lungs. Also, coughing. If you feel the need to cough, coughing often is helpful. To help prevent blood clots, in addition to the prescribed blood thinner we'll be giving you, you'll be wearing these boots. They squeeze your legs gently, and that encourages blood flow. You'll also be encouraged by the nurse to move your ankles up and down, which activates your muscles and prevents blood clots. We'll be giving you some other medications after your surgery. Um, in addition to your normal medications, which we'll order for you as prescribed. There will be medicine in case you have nausea. We'll be giving you medicine to prevent constipation because the pain medications, oxycodone and morphine, cause constipation. And if you do need a blood transfusion, which we'll determine by the blood tests after surgery, you will be given a transfusion if needed. If you're due for a flu or pneumonia vaccine, these are safe to take after surgery, so you may be offered that after your surgery. And if you require an interpreter, they are available 24 hours a day. We usually use an iPad, excuse me. And now I'll pass it off to Lauren to talk about case management.
Thanks, Taylor. Okay, so case management is a very important part of the total joint surgery process. They are nurses and social workers who will work together to figure out the best plan for you after your surgery. You'll receive a phone call in the weeks leading up to your scheduled surgery from one of our hospital's case managers, and the main purpose of this phone call will be to confirm your active health insurance plan and also to begin talking about your plans for after your surgery is over. Patients having total shoulder replacements done will typically spend one night in the hospital and then go home the next day, but this can vary. People having total knee and hip replacements usually spend a night or two in the hospital, but again, this will vary between individuals. And then in the past year or so, we've also begun to perform same day outpatient joint replacement surgeries for those patients who are appropriate and interested. So there are three options for where you will go when you're ready to leave the hospital after your surgery. The first option is to go to a short term rehab facility where you might stay for a week or two and continue to get care and regular physical therapy. And then the second option is for you to go home and have a visiting nurse and a physical therapist come to your house. You would typically get physical therapy about twice a week at home until you're ready to go to outpatient PT. And this brings us to the third option, which is to go home with no services, but to attend outpatient PT immediately. This is not usually our preferred option for you, but sometimes it's necessary if patients have limited insurance coverage. The decision for whether you go home or to a rehab facility after your surgery can depend on a few things. The first is your health insurance coverage. Some plans will cover rehab or for services to come to your house, and others will not, in which case patients just start their outpatient therapy immediately after they go home. The second factor is at what level you were functioning before having your surgery. The third is whether or not or how much support you have at home, including family or friends that can stay with you and help you. And then finally, the number of stairs you have at home can also play a role in how realistic it is for you to go directly home after you're sent home from the hospital. So, for patients who are admitted to the hospital after their surgery, you can plan to begin working with physical therapy almost immediately. If possible, physical therapy will come work with you later in the day on the same day that your surgery is done. And you'll most likely be able to bear as much weight as you can handle on the leg that we do surgery on once it's over. And then in the hospital, you'll work with PT usually once or twice a day, and they'll help you practice getting in and out of bed, walking in the hallways, and trying to go up and down stairs if you have stairs at home. And they'll also start bending your new joint and working on some strengthening exercises. Every day that you're in the hospital, you'll work with physical therapy and you'll hopefully be able to walk a little longer each day and become more independent in your walking and mobility. You can expect to use a walker, at least in the time immediately following your surgery, although some people prefer to use crutches. And then you'll likely transition to a cane after a short period of time. Just as a reminder, those patients that have a knee replacement done are going to have the knee immobilizer on their leg while they're walking. And then those people having a hip replacement will be using their abduction pillow at least while they're in bed. So in the hospital, you'll also work with occupational therapy, and these therapists work in conjunction with physical therapy, and they help you with what we call activities of daily living. So this includes helping you feel more comfortable bathing, dressing, and using the bathroom as you recover from your surgery and get used to your new joint. What we refer to as hip precautions are an important part of the post-operative course after you have a hip replacement surgery done. So, for the first 3 months after surgery, there are three different motions or positions that we ask you to avoid because they put you at risk of accidentally dislocating your new hip joint. So, the first position to avoid is one where you bend your hip past 90 degrees. So, the two pictures on the right show the two ways in which you might do this. People sometimes have trouble if they sit in a very low chair or toilet seat, or if they're bending forward while they're sitting down, like to pick something up off the ground. The second position we ask you to avoid is turning your surgical leg in towards the other leg, which is shown in the picture on the right here. And then the final position is we ask that you do not cross your legs, either by crossing them at the ankles like the far right picture, or by making this sort of figure of four position in the middle picture. So here's a brief overview of the timeline you can expect as you recover if you're having a total shoulder replacement surgery done. So for the first month, you're going to be in a sling at all times and not moving your shoulder at all. After about a month or so, you will still be using the sling, but you can start what we call passively moving the shoulder with the help of your physical therapist. Then around 6 weeks, you can start moving the shoulder on your own. And you'll probably have your normal shoulder motion back by around 6 to 9 months, but you should really expect it to take about a year before you have full function of the shoulder without pain. So, regardless of whether you go home or to a rehab after your surgery, you will eventually be ready to transition to outpatient physical therapy. And this will help you sort of continue to improve your mobility and get back to your more regular activities. You can expect to attend outpatient physical therapy probably for a total of about 2 to 3 months after surgery. The schedule might vary a little bit, but it will likely be about 2 times a week, at least in the beginning. And you'll also be expected to do these exercises at home on your own on a pretty daily basis. And then you and your therapist can sort of work together to decide your schedule, and this might include in person sessions and televisits. Many people ask when they'll be ready to drive again, and the time it takes really varies a lot between individuals, but we usually say that around 6 weeks is pretty typical. So, in the beginning, you're going to need to arrange rides to PT and to your medical appointments, usually from family or friends, or you may want to explore some ride services like the Ride. So it's important to think of PT as active exercise. This means you should wear comfortable clothes to your sessions and make sure that you're hydrated and taking any medications such as pain medicine that you need to before you go to your visit. There are a few pieces of medical equipment you'll need after your surgery. Many people find it helpful to have either a shower chair or a tub bench, which are shown here, though these items are not technically required by us. They can be helpful during the initial period after your surgery if you're uncomfortable standing for a long enough period of time to take a shower. And then this shoehorn and sock aid are other kind of extra accessories that can be helpful for getting yourself dressed if you're going to be at home by yourself, though they are again not required. A raised toilet seat or a commode is recommended after surgery. And actually, if you're having a hip replacement, one of these two items is required. So, the reason for this is that you are likely to bend your hip past 90 degrees by sitting on a lot of standard toilet seats, which again is one of those three hip precautions, and it puts you at risk of dislocating the hip. These are not exactly necessary for people having a hip replacement, but sitting on a low toilet seat might cause you to bend the knee to a degree that's uncomfortable, at least in the beginning, so some people prefer to have one of these. So this just kind of outlines which items might be covered by your insurance. Many insurance companies will cover at least some of the items we talked about. So the walker is the most essential item that you need after surgery, and it will be covered by most insurance companies. If you need, we can provide you with a written prescription for equipment in the office at one of your pre-op appointments with us. We often recommend that you reach out to your insurance company to help you in getting your equipment. And then if your insurance doesn't cover these things or you want to just get them separately, we recommend the Masons program, which is located in Woburn. And it's basically a program that allows you to borrow some of these items for free and use them while you're recovering from your surgery and then return them once you're done. So, once again, we will all work with you to make sure this process goes as smoothly and successfully as possible. And we encourage you to just call our office anytime or send us a message if you have any questions that come up.
Thank you all for attending the class, and you will also need to fill out a survey. There will be a link provided at the end of this presentation, and we will see you soon.